Hello, this is Dr. Sohan, oral and maxillofacial surgeon at Eledent Hospitals, Banjara Hills. Today I am going to discuss on topic basal implants. So, what is difference between basal implants and conventional implants? Conventional implants and basal implants are nothing. They are almost same, but there are some advantages of basal implant on compared to conventional implants. And what are these advantages? I'll be explaining you in this topic. Usually conventional implants, when they are placed, after placement of conventional implants, usually we take 3 months for giving the permanent crown. Whereas this in basal implants, usually after placing an implant, within 72 hours we can give a permanent crown. And in which cases this basal implant can be used and compared to conventional implants. Basal implants can be used in all of the cases, especially in the cases such as where there is excessive bone resorption, when there is in such bone resorption cases where we need to avoid bone graft, we can bypass the bone graft and we can place a basal implants. So these basal implants take support from the basal bone, that is cortical bone, which is the hardest part of the bone. Usually conventional implants, they take support from the alveolar bone, and conventional implants works on the concept of osseointegration, whereas the basal implant work on the concept of osseo-fixation, and there are less chances of resorption of the basal bone, and we can also overcome peri-implantitis. And this basal implants can also be used in periodontally compromised cases where immediate extraction can be done and immediate implant can be placed, whereas even in the conventional cases, using conventional implants we can place an immediate implant, but whereas a permanent restoration can be given only after the osseointegration, that is after the 3 to 6 months, whereas in the basal implants we can give within the 72 hours of the implant placement, and time consuming is little less in the basal implants. Avoid sinus lifting procedures, we can avoid bone grafting procedures in basal implant cases, whereas in conventional implants we need when there is less bone available, and if there is any infection in periodontally compromised cases, only after the extraction and after delayed healing, then only we can place in conventional implants. And the main advantage of this basal implants is the immediate loading, that is immediate crown fixation after placing the implants, that is within the 72 hours after placing an implant we can place a permanent crowns, whether it might be full mouth implants or whether it might be single tooth, whereas it might be multiple 2 or 3 teeth missing. In such cases also basal implants are placed, and this support is taken from the, as I said, from the basal bone, that is a cortical bone, where fixation can be done and immediate within 72 hours we can place a basal implants. So these are the advantages of the basal implants over the conventional implants, that is regular conventional implants. Thank you.